the focus is on hygiene more than on hardware. So at the core are really these simple hygiene activities or cleaning activities. So of course there is hardware, and hardware is required, but we are not into building toilets, or this is not what the focus of our program and approach is about. It's on skills-based learning and habit formation more than the curriculum-based approach or health education in classroom. So it's really about doing these activities and with this forming habits. For the facilities, for example, the washing facilities or the group washing facilities, we usually focus on low-cost solution, or let's put it that way, appropriate technologies for the context, so that schools can also, first of all, afford them, even though they have limited resources, but also that they are able to maintain these facilities and get or keep them running. We very much focus on a stepwise process. I will later on explain a bit more about that. So it's really how to support schools and governments to improve gradually their water, sanitation and hygiene situation. As I mentioned already, school-based management is a very important aspect on school level, including the stakeholder involvement, which of course has to do with school management or school-based management capacities of the principal, if and how he or she is able to involve and engage stakeholders. And the models that we promote should be simple enough to really be integrated in the education sector, not only on school level, but also on subnational level, on district level or provincial level. This is important to have the possibility to scale that up, or for government partners to really pick up the program and scale it up. So you all might be aware that the realities we see in schools is often rather shocking. There's no or limited access to water and toilets. If there are toilets, they're often locked, or they're not functional, or they're so dirty that you really don't want to use them. There's a lack of hygiene behavior, and there's often no or very limited funds for WINS, but also for other school health-related activities. Then on the opposite side, we have national standards, and they are often existing, which defines how many toilets should be in the school, that there should be safe drinking water, that hygiene is observed. But then there is this huge gap in between, and the question is, how can we support schools to improve and to reach these national standards? And this is where this 3-star approach for WASH in schools comes in, and that's the stepwise approach that I mentioned before. So an approach that we are promoting to really gradually improve and to focus and start with some very doable, simple interventions that even schools with limited resources can start with on their own and gradually improve from there. So to bring them on the way, because often they are completely overwhelmed if the reality in their school is so bad and they have national standards and they feel they can anyhow never reach these standards. So how to bring them on the way, or how to support them on their way. So this is basically what it is about. The 1-star, or that is of course to be defined, because going back, this is more a general approach that needs of course to be contextualized to the specific country context. But the idea is that under 1-star you really focus on very basic things, daily routines to promote healthy habits, cleaning of facilities that are already there, very simple steps where not a lot of support from outside would be needed. Then the 2nd star is a gradual improvement, and we observe that in our partner countries, that once schools start to at least build a tippy tap, or start something very basic in WASH to improve their water, sanitation and hygiene situation, that was often an entry point. And once the communities got involved, they themselves wanted to improve it and make it better and climbed up the ladder, so to say. So this is just a bit on the background of this 3-star approach or this stepwise approach. So I will now introduce you briefly or give you a brief overview of the regional Fit for School program. So we work in Southeast Asia, and we basically started in 2011 with the first phase of the program. And we brought an approach that has been developed by the Department of Education in the Philippines to 3 other countries, to Laos, Cambodia, and Indonesia. So in the Philippines, this program, which is also called Essential Healthcare Program here in the Philippines, could be scaled up by the Department of Education to about 7,000 schools, targeting about 2.3 million children. So in the Philippines is also where our regional office is based. And together with our regional partners, SIMU Innotech, the Southeast Asian Ministries of Education organization and their regional center here in the Philippines. Together with them, we support the Ministries of Education in Lao PDR, Cambodia, and Indonesia to implement and scale up this program. So in this first program phase, we basically help them to set up model schools and to contextualize the approach and the templates to their respective country context. And now in the second phase of the program, which started at the end of last year, we focus much more on the scale up of this program. So this is a brief overview. I don't want to go into too much detail, but this is basically what we as a program do or offer. We provide technical assistance. So that means we support with the development of guidelines, the development of scale-up strategies. We support the alignment of development, or we support the government partners to coordinate with different WASH in Schools partners, for example, in technical working groups for WASH in Schools, like we have a very good and functional one here in the Philippines. And on subnational level, we focus on human capacity development, knowledge management and sharing, development of implementation guidelines. We also supported a lot of research in the first phase specifically, and the development and integration of monitoring and evaluation tools. What we basically don't do is implementing the program. So the program is always implemented by our partners, which are the Ministries of Education in these countries on different levels, but we don't implement ourselves in schools. So this is clearly the task of our partners. So as I mentioned before, the focus of the second program phase is much more on sustainable scale-up of the program. So as I mentioned, in the first phase, we were focusing more on model schools, and that was quite successful. But of course, as you all know, the challenge is then often to bring it beyond this pilot and model school phase and to really bring things on scale. So what already started at the end of the first phase was that that more schools in certain areas, let's say in a district or in a city, started to bring that approach to other schools beyond these model schools. And I will give an example from Lao PDR later on, how that looked in their case. And of course, the focus of the second phase is really to scale that up, bring that on national level or reach national scale. And of course, that brings along that we focus a lot on monitoring and evaluation. So to really integrate monitoring and evaluation for water, sanitation and hygiene in the education system, in the monitoring system of the education sector. So while the first phase was really more on research and development, and the development of implementation guidelines on school level, focusing very much on the model schools, see how it goes there, what can work in this respective country, and the support to model schools. The second phase is now really more on support to partner systems, monitoring and evaluation, accreditation systems, to really scale up the program. The capacity development in the first phase was really more on model schools. What we as a program supported also in these model schools were kickstart materials, that means the hygiene materials and supplies, at least at the beginning. And we also at least partly supported the facilities, but it was always a core principle that the schools have to contribute and that communities contribute, and that we don't pay and bring all the facilities there. It was a contribution and we contributed something, but we didn't pay that completely. So now in the second phase, the capacity development support is focusing more on subnational level, which means the provincial offices, provincial education offices, or district education offices. And with this, it's also expected that the government ownership and steering of the implementation increases, and they are more and more in the lead of scaling up this program, and our program support is really getting less, and we try to encourage the partners to take over and be in the driving seat. So as mentioned, I would like to introduce you to one scale-up model that we documented in Lao PDR. That was an analysis or study that we conducted together with our regional partner, Simeo Innotech. Because in Laos, we saw one very successful district, the Sisatanak district, and they were able to scale up the program from 5 model schools in this district to all of their schools, which is 40 plus schools, without the support of the program. So as I mentioned, there was support in these 5 model schools. From the program, we supported some kickstart materials, and also some we contributed something to the group hand washing facilities, but then they scaled it up without further support from our side. Even the orientation trainings were conducted by them. Of course, our staff, we have one national staff there in Laos. She was in the model school orientations more involved, but later on her role became smaller in terms of conducting the trainings, because the district team became more knowledgeable and also more active, and later on she was only there, our staff was only there as a kind of a resource person. So the outcome of this analysis is this one research update, this printed material you can see in the slide. And there's also a video, there's a short version that gives an overview of this scale-up initiative in Laos, but then there's also a long version in Lao language, which the government partners now use in other districts to basically demonstrate, okay, what went very well here in terms of district management, and what were actually the success factors for scaling up that program in this district. So as mentioned before, in 2011-2012, there were 5 model schools in Sisatanak district. And in the coming years, 2012 and 13, there was already a good share of surrounding schools to adapt this program to their schools. And by 2014, all schools in the district implemented the program. And how that happened, I will try to explain to you now. We basically looked into key findings on different levels, from national, via provincial, via district, via school level. And I will start with these national level. So what were the key findings and the essential factors to enable this scale up? There was, first of all, a very conducive policy environment and relatively clearly defined roles and responsibilities on all levels. I will show you some overview of this in a bit. The ministry officials were very supportive and integrated the program and the orientation on the program in events that were already ongoing. And what they emphasized on national level was this approach of starting small and using a stepwise approach, that was very encouraging for schools and also for the district officials to pick it up, because they somehow felt enabled to do that. They didn't feel, oh, that's so sophisticated, we cannot do that without any support. But they felt, okay, that looks pretty simple, that looks pretty easy, I guess I can do that in my school. So that was an entry point. The accessibility of model schools during this first phase was also mentioned as one of the key factors. So even national level could bring or could organize knowledge or learnings and knowledge sharing events, bring people to the model schools and so on. And these school visits and learning exchange were really one of the most convincing factors. One of the government partners said, is to see is to believe. So that were the really convincing moments. And this is referring to this policy environment or supportive policy environment. This is a bit an overwhelming slide, but on the right side you see the schools of quality approach that is implemented by the Ministry of Education in Laos. And they also have a school health policy, which has 7 components. So they are partly overlapping, partly not, but we try to showcase how the program and its interventions would fit in there. So there were already existing policies, and the program was completely in line with these policies. Okay, and this is referring to the roles and responsibilities on different levels. So on national level, there's a school health task force, and also on provincial and district level, they have school health task force or people really assigned to these topics, and that goes down until the school and communities. So there were really clearly defined roles and responsibilities. So on provincial level, the key finding were to use existing meeting structures for advocacy and dissemination of learning. So what happened there was, when the provincial teams had meetings with the district teams, they shared the experiences of the program implementation. Or people model schools because they were nearby. So they basically used existing structures. We did not create separate or big separate events for the program to be shared, but they somehow organized themselves in a way that they used their existing structures and shared, amongst others, also learnings from this program. So this knowledge sharing and learning exchange between districts, that was really the role of the provincial level. And having assigned teams to work on the program from all levels, so this roles and responsibilities was also emphasized by the provincial team, and also the district and school management capacities, so that they really developed a sense of ownership of the program, and this was really to be seen on all levels. So here is an overview again what the role of the provincial team was, mainly to share information and to be involved in the orientations, share their lessons learned from the Sisa Tanak district, which was one of the districts where the program got implemented. Then also provide solutions and support that the districts and schools would need according to their to the circumstances they were in. So also a bit of tailor-made solutions depending on where the respective district or schools would be, and also to encourage districts and schools to implement the program. So they also had a very how to put it, nice way of dealing with each other. It was more an atmosphere of encouragement rather than checking on districts and checking on schools and having a bit of fear, which monitoring can sometimes also be seen as. So this encouraging attitude was also quite supportive for the scale up. So here again, one overview of the district and school management structures. As you can see, the upper part, the green part, is the district management with a director, with a deputy director, but then a district is usually, and that applies not only for CISA-TANAK, but for all districts, organized in clusters. So in CISA-TANAK, they had 3 clusters, and every cluster is managed by one pedagogical advisor who belongs to the district team, and one cluster head, which is one elected school principal in this cluster. And these 2 are in charge for one cluster. And these organizations in these clusters really helped to share the knowledge within these clusters. So these 2 people were very important in terms of sharing and bringing the approach to other schools. And they were also the ones who basically conduct the monitoring. So it's this district team who is involved or who's conducting the monitoring in that case. And then we have this entire block of school management, which involves, of course, school principals and teachers, but also the community, the village education development committee, as it is called there, but also local authorities. So this is then, again, the task of the school management. Then key findings on district level. What did the district team do to make this scale up happen? Also there we saw this very effective and efficient use of existing structures, such these school clusters, what I mentioned earlier. They have regular meetings, and the district made the school of the cluster head a model school. And in this school, regular meetings of this cluster take place. So by nature, all of the other school principals in this cluster will get exposed to the program. And often it's just the hardware, the facilities they see, the group facilities, where they get curious and ask, what is this, what's going on there? So they really used these existing meeting structures and were very good and strategic in choosing the right model schools. They were very proactive and were very proactive in terms of knowledge sharing and encouraging the schools in implementing the program. As mentioned before, this pedagogical advisor and the cluster head, they had a good understanding and knowledge of the program, and they also had good communication and mentoring skills, because also there it was a very encouraging environment. They somehow created the demand. They saw other school heads saw the program in the school. They said, oh, can we also do that? And then they were trying to encourage them and said, yeah, maybe you start with this and that. So even if they found something later on was not running perfectly well, they would address it in a very nice and skilled way. They would not be super strict and say, oh, this is all wrong, what are you doing here? But step by step, they would encourage new schools to adopt the approach slowly. So these clusters, these 3 clusters, what I mentioned before, really became the knowledge hub for sharing learnings and experiences. And the more schools adopted the program in one cluster, the more encouraged the schools became that were not yet implementing the program. So once a certain tipping point was reached, these other schools were really like a bit under pressure, saying, okay, now almost all the schools have it in our cluster. I also want that program now, otherwise I'm one of the schools who cannot provide that. So there was also a certain effect in this regard. I already mentioned that with the supportive atmosphere. Yeah, then it was also a relatively good socioeconomic and geographical conditions for this district. So this district is not in a very rural area. It's more of an urban, even though there are rural schools, but it's also geographically relatively small and it's easy to access. So this also needs to be taken, of course, into consideration. So we are at the moment, or we are supporting the government partners to bring that now to other more remote districts, and we will see if the same applies there, or if there again need to be some adjustments. But at least for this district that worked, and there is at least some idea on what are the success factors. And then in this district, school communities were also able to raise sufficient funds, even though it's still low cost. There were some funds needed, and the communities were willing and eager to contribute these funds after being motivated by the cluster heads and also by the school principal, of course. So here again, the role of this pedagogical advisor and cluster head, they became really a core team to ensure participation of the community in the program implementation, to expand the program within their cluster, as I mentioned, and really to support sharing of implementations, guiding schools within their cluster if requested, and support other districts and provinces as serving as model schools and role model, because they also had visitors to come and where they could show the program then again. Okay, and then on school level, there were also learnings and key findings on school level, of course. The stakeholders in the model schools became really role models for other schools in their cluster, and what was very crucial was really the school-based management capacities of the school principals. As I mentioned before, that is very crucial on school level, and that includes the community involvement and the ability to create ownership from the very beginning throughout the entire process, leadership to be committed to the program and able to lead stakeholders like parents and so on. But there was, as I said, also a good dynamic amongst the principals in one cluster, because at the point where most of them did it, even maybe not so much encouraged school principals would go along and would start with a program. Also financial management and accountability. There is the situation that in Laos, the school operating funds are either extremely low or not existing. So what happens is that the school principal has to also look for other sources of funding, and then accountability, of course, comes into play, because an accountable use of these funds is very crucial to maintain that support and investment in things that also the parents really find are worth supporting. They integrated the program in their existing school development plans, often under the section Safe and Healthy Environments. And they also became very active in knowledge sharing, for example, for fundraising or with other schools. They were proactive and willing and very eager. That was something we saw throughout the entire district. It for sure has also to do with the good district management or the good leadership of the district. And there was a strong ownership of parents and to really to commit to the program to begin with, and then also to sustain the program, because since, as I said, they also invested some parts, they helped to construct the facilities or whatever. So this contribution of the community also helped to really hold the principal accountable for sustained implementation. And then there were regular monitoring activities within the school community, so even parents were involved in checking if the program is still running, if the facilities are still working, and so on. So this is basically summarizing it again, that community involvement is very crucial. For example, they had meetings on what kind of facility they really want, and that also created ownership. And they saw a facility in one school, they tried to copy it, but then some parents had even ideas how this could be improved further, so that created even more ownership. Yeah, that is basically what I wanted to share with you. And I already see that there are a lot of questions, and yeah, maybe we can already enter the discussion.
Excellent. That was a wonderful presentation, Nicole. Thank you so much. There's been a lot of activity in the comment box, and we have a number of questions. So I've been recording them. Let's start from the top. Jinping, you had quite a few questions, which I hope that we can get through all of them, but we might start with the first two and then give a few other questions or participants an opportunity to ask questions. So let's begin. Nicole, Jinping asks, how do the M&E for the first phase of Fit for School, how do you do the monitoring and evaluation for the first phase of Fit for School programs? Who does the M&E? And after the 4 years of implementation, what changes happened among the targeted children?
Okay, so for the M&E part, we tried from the very beginning of the program to really do monitoring via the district teams, and on school level also involve the communities in monitoring. So they were really involved in checking in the school, and we also try to use these district structures because the district teams, their task is usually to monitor schools, right? Not only on Washington schools, but in general to monitor schools. So what we try to encourage is to use existing structures and to use their existing monitoring visits and integrate the monitoring of this program there. At the moment, in the second phase of the program, we really try to encourage the inclusion of monitoring of these WINS programs in the National Education Monitoring System. And there are, of course, the Education Monitoring Information System. You cannot put too many questions on Washington schools in, but we try to at least include some core questions and also questions that are referring a bit more to the functionality of facilities, because what we saw so far, it's basically counting toilets or counting infrastructure, what you sometimes already see in the education monitoring systems. But what we are more interested is the functionality and the accessibility of these facilities. Are they really functional? Are materials like soap available? So we try to include these aspects more in the monitoring systems. I don't know, I hope that answers your question. And then how to ensure the quality. Yeah, the quality is again very much referring to the monitoring of the program. At the moment, we are about here in the Philippines to support government partners with the monitoring of their new Wash in Schools policy and program. There are also new technologies explored here at the moment where the data encoding is done via cell phones or to enable these gathering of data. And of course, you will never be completely sure, but we believe that if it's integrated in the monitoring system and ideally also linked to performance ranking, then of course you have a higher chance that implementation quality can be maintained. And we are trying different approaches in the different countries. Sometimes it's also a or schools report to the district by themselves, so it's a kind of self-evaluation, but then combined with random spot checks to see if it's really going on, if it's really happening. So we are trying different things, but the monitoring is really at the core of the quality assurance. Yeah, and then what impact? The impact. Yeah, we did an impact evaluation at the first after the first phase, or after 2 years of implementation. And we saw, of course, in the model schools an improvement in water, sanitation and hygiene facilities, but also the activities were increased, and we saw slightly more that the cleanliness of toilets, because this keeping existing facilities clean is also part of what we promote. So we also saw that there were more clean and functional toilets in these model schools. And in terms of health impact, we saw an improvement of oral health throughout all the countries, because daily toothbrushing with fluoride toothpaste is also part of the intervention package. What we saw in the Philippines also an improvement of body mass index and reduction of worm infection rates, but we did not see that in the other countries. Part of the explanation for that is that the worm infection rates in the schools where we did this research were surprisingly low. We expected a similar high rate of worm infections in the other countries, and then, of course, with the deworming and the hygiene activities combined, you will most likely see increase in body mass index. But we could see that in the Philippines, but not in the other countries when we conducted the research.
Great. Thanks, Nicole. I'm going to actually transition over to Caroline's question, because that follows on quite nicely. And she asks that she'd like some information about the GeoHelminth or STH prevalence, as you recommend deworming twice a year. But WHO has modified their recommendations for deworming according to their prevalence in sentinel sites. Can you comment on that?
Yeah, what we basically do, we don't recommend things on our own. We just support in terms of deworming national programs that these countries have. So all of these programs have national deworming programs, and we basically support them with implementing these national deworming programs. And I think we also have to see in these the data we gathered in these model schools and also in control schools, the rates were low, but especially for Laos and Cambodia, I think the rural areas will look completely different, or we cannot conclude that the worm infection rate is that low in all the schools and with all school children in these countries. So it is probably still very high, but it's also, what I also have to add is that especially in Laos and Cambodia, they have very well implemented national deworming programs running. So it could also be that since these programs are implemented rather well, the infection rates go down. But as I said, I wouldn't want to say that this is representative for the entire country. We cannot say that. We cannot conclude that from the data we have.
Okay, great, thank you. So let's continue with the questions list. Let's go to Doug's question, where he's asking for you to describe the learning activities at the school level and how the students' learning is monitored.
Before we get that, before Nicole answers that question, I just wanted to congratulate Nicole and the team for the way the program has been integrated within the education system. There are so many lessons that you've learned there that need to be shared more widely than they are often. It's such a systemic approach. I was really fascinated and really enthused by it, or it's early in the morning here for me, but it really pleased to see that kind of approach and working through the clusters and through the structures. It's very, very positive. But my specific question was about learning, partly because we're starting a global project on health literacy and trying to figure out how in schools and communities like this, how the learning is occurring and how it might be monitored.
Great, thanks, Doug.
Okay, yeah, thank you, Douglas. Thank you. So what we focused on so far was really more the actual practice, really doing it every day, creating a routine and providing providing a more supportive environment to practice this routine. And really get it in, because schools or school days are often created around routines, or there's a lot of routine in a school day. So making these hygiene habits part of this routine and getting the children to practice these hygiene habits on a regular basis was more the kind of interactive learning. And of course, first that would strengthen their skills to do these activities, but hopefully through the routine also improve the habit formation part. In terms of learning about the background, we found that in most of the countries it is in one way or the other already part of the curriculum. But of course it also depends a lot on the capacities of the teacher, on how these things are actually taught in classroom, and if it's done in a very interactive way or if it's just merely facts or a poster at the wall. So we were really more focusing on the skills and the routines, but we were not so much focusing on the teaching in classroom yet.
Great. Thanks, Nicole. So let's move on to Lutfrid's question. In terms of materials to schools, who provided materials like infrastructure and soap?
Okay, yeah, so for the model schools, we provided some kickstart materials, which were hygiene materials, but only at the beginning. And for the infrastructure, we contributed something because we promote very low-cost facilities. I don't know, in the picture that you see now where the little girl is washing her hands, you can see there are no faucets. It's basically a punched pipe, which can be opened at the end and closed. There's also possibility to have individual hand washing there, but that's just an additional thing. This is basically because there are no faucets, because faucets get stolen, faucets break. So we try to promote very simple and cost-effective ways for these facilities. So we made some suggestions, but what we see is also that some schools say, oh yeah, that looks nice, but we want to have a more sophisticated basin. We provide the most simple solution. If they want to have something more sophisticated, they would need to build that on their own, and most of them did. And then, but that was only for the model schools. For the scale-up schools, the one that I just presented from Laos, the schools and the communities, also the wider communities, were able to raise funds for these facilities on their own. We did not contribute, but we provided some technical assistance, we provided some examples, we provided materials where different solutions for these group facilities were presented.
Great, thank you. So there's two questions that kind of lead on to that. Let's start with Yuka's question about water quality issues. She says, the quality of water which is provided by tippy tap or punched water pipes, is this acceptable for drinking, for brushing teeth, and for rinsing their mouth after brushing? The quality of water is important. Both MOE or is the Ministry of Education or the Ministry of Health monitoring the quality of the water?
Yeah, important question. We do not encourage to drink that water because we know the quality is often okay for hand washing, but not necessarily for drinking. So we have different ways of addressing the drinking water. For schools that really don't have anything, we encourage the students so that it is a routine in the school that every child at least brings some water from home for drinking. But that's only if the school has really nothing, and there is also no possibility to guarantee that the school will provide safe drinking water. Of course, later on, water treatment and provision of safe drinking water is again the best option and the national standard, but we will try to provide steps for the in-between. So for toothbrushing, we actually encourage them not to rinse their mouths because the fluoride is more effective if it remains in the mouth. So they just spit after brushing and they clean their mouth and the toothbrush, the mouth from outside and the toothbrush, but they do not rinse their mouths with water. That's at least what we encourage them to do. Yeah, and then we also we look what is the national standard for water quality testing. So, and in most of because it's also a lot, or it's sometimes too much to ask for schools to also be in charge of water quality testing, or how would they do that? But what we try to find out is how it is dealt with in this country and what are the national policies and guidelines on this, so that that they link up with the agencies that are in charge for water testing, and that could be different institutions in these countries, but we would then try to enable the education sector to link up with the responsible agencies, and we would support to create these links so that it really actually would happen.
Okay, great, thank you. And then there was another financing question from Lambert. He's asking who finances the activities of the assigned teams at the district level or at the provincial level, and at the provincial level?
Yeah, so there were some kind of learning exchanges that we supported as a program, but the main part and the visits and what happened within the district, so these learning exchanges were more on national level, but within what happened within the district and in the provincial team is really what they anyhow do, or the visits and activities they anyhow conduct. For example, the Ministry of Education organized, when was that, early this year, there was a big meeting of all provincial teams in Laos. It was a meeting they did anyway, and then they came up with the idea, why do we not have half an hour to present the program and to share the learnings from CISA-TANAC to all the provincial teams that will come. So it was not that we paid to bring all of them together, but it's more they organized a meeting, or it took place anyhow, and they used this as a platform to present the program as well. And that's a way that we strongly encourage, because our program will end at a certain point, and of course we don't want everything to collapse at that point, but to look how could they on their own distribute and share the knowledge without too much financial support from our side.
Okay, thanks, Nicole. So I think we have time for maybe one or two more questions. So there's one more question from Lutfrid. What do you mean by the other sources of income? Again, building off these income questions, because she, from her own experiences, she's tried to encourage teachers in Tanzania to start programs with Fit for School issues like gardening, but there seems to be challenges and the teachers are not willing to have gardens. So slightly different issue, but again, I think trying to get at the root of what were the most important steps to have these schools buy in so that there's more financial ownership on the school level, Nicole?
Yeah, I think that indeed the district teams and the cluster teams played quite an important role with this. It was not even us so much doing that, but it was more that the facilities or seeing something nice in a model school did spark their interest or their curiosity. And then especially with the facilities, since they also look like something that people can somehow relate to. They are not too high tech. It somehow, we sometimes call it the MacGyver effect, because people see the facility and they feel, oh, this looks good, but I have a better idea. You could improve this and that. And then that was somehow what sparked their interest when they saw it in the model schools. And then they wanted to do it even better than what they have seen in the model schools. So this was something that was then further encouraged by this cluster team, by this pedagogical advisor, and this one school head that already implemented the program. And they provided technical support and provided everything the schools would need. But it was not that they were telling them, now you also have to implement it. It was more, they were somehow triggering their curiosity. And once that was triggered, they would feed in the technical experiences and share what the schools would need to get something started. That was at least how it went in this case. I don't know if that would be applicable in your case in Tanzania.
All right. I would just like to thank you for that response. I'd like to thank everyone for your participation today. I know for some people it's the very end of their day, and for some people you're just starting. So we appreciate everyone joining. This has been a very interesting conversation, learning about the Fit for School approach. Great questions. And I would like to remind everyone that we will be both sending out a recording of the webinar, so feel free to share that with your colleagues, but also that we will be holding another webinar next month. And I think the topic is still being finalized, but we will be sharing that shortly. Look for an email coming from the PCD. So with that, we're about 1 minute before 9, so we're finishing just on time. And a very big thank you to Nicole.
Thank you, Jackie, and thanks to everyone for listening. Thank you.
Okay. Great. All right. Bye, everyone.